And then for baby Ghana for I guess Ghana for a papa nina the health minister and send be out there to down a press conference as in how almost handle nurses or more strike no issues in no yeah they say ama and I'm a bufu kese pa aba abusia no for baby obi ekata na Ghana for baby a chere o madwam de o madwen chere nina brem na o say u trend na they say ahomaso a ewo NDC minister sinimu na abusia. It's very alarming. I have been pa who here say ni money mu ya itimi hwena ye can answer because the minister na kasa yemu as I say graduate he is calling on retired nurses me wafo ne nkoko for me wafo ne nkokorafo a omabaye eduma twam azabre obi kura no omunyina da fie jojo mo no they are calling on them so mumma me stepping in me take over until somebody resolve the issue instead of tackling the issue no they are saying say emrwafo ne nkokorafo ne me step in on me na bisha nse mi ba epi nkofo bebre echo ma je beda bia na me kana se mba Ghana fo munya abotena munya muntiri mu ansa na bia motima take mu decision. The issue was that agreement omunyina na health ministry no any nurses no almost ko no ekoye no ntia they were promised say omo letters omo de bibia akwa Ministry of Finance say condition of service omo ka ho asema omo agree no last year 2024 no ya dey so omo capture bibia enche bibia betimi ya farm once abeka de omo requesting nyina na bibia later budget by ya man for man and shame they still went forward for inquiries could be say oh nya botre na the letters akọ Ministry of Finance ayeguso eduhud manabusia no so after some time almost an opinion mo minister meka say me inta budget ne ya budget na wie ya mfama nche ba bia intino ye nyeska emma ana mo kirem say ye ba afa ye ba betra say negotiation mo aka kire say wo the latest ekọ Ministry of Finance it is then as say wo ba be ka kire say ministry they say wo ba be ka kire so my boy bibia we it is so one kind next year ton March mu anase be December mu ye kan budget na ne the march the put be at the march into next year no say no masa san hada no say this in na da there because so person next year just tell the truth to the association from the beginning say oh I feel with the age into next year any the baby and never support but what that almost say you have taken it up no munya botre mu the coffee na Ministry of Finance ne be adwuma na akiri ankoye adwuma no bia na da pa na no na man nesifo ompenifo no ebu afuye pa na bia ko ne ko fanse no ntire mu nyina bra wo ya na wache wagen no comment section ase.
The guy who sits in Amsterdam, is it Amsterdam or Denmark? Is Mr. Happiness. He put some video up that was also on the platforms that was quite trending quite a bit. So I decided to share with you. So let's see that video from I don't know his name, Tvghana or something like that. Yes, okay. Have a look at this video.
Akando, Health Minister Ghana. And then who knew say who catch registered nurses and midwives for say their demand no there is no space in the budget for it. Gross disrespect. I didn't hear. More in election, December, more core transition. See the previous government, mamo, everything that was happening under them. The who say no money registered nurses and midwives for no agreement, even though we implement it. And the who say, and the agreement then you favorable to more mobile power now. I was saying money registered nurses, every negotiate, and some ready budget. But Essan said, moon respected the nurses in Tino, moon ready budget, and I'm too on demand. And then when you got a catch on, say there is no space in the budget for them. And the retired nurses and midwives, retired nurses and midwives, what disrespected the profession of nurses and midwives all Ghana, including the President John Dramani Mahama. Because 1st July, Oma Tiska said National Day of Prayer. Oma organizing a so far conform. I bet now some Bompire Magana. We said almost started some Bompire Magana. Then it's Ghana. Everyday corruption. Yes, about time, Aquaman Probi Hospital. Nurses in Yonti Apama Musomukufi. Mupasam we are nan kofu and sana mabeka say Ghana nurses ni abadayo mutimu ya din say anything. Oh, as a health minister, obi out from who say educated, classroom educated. Ka so hu nyansa wo. Na wo ka tro mo say ye pamucho. Mu demand no. Previous government then ejitumba we implement it. Yes, you are buying economy ni enti na yam fan budget by pamucho. Mu demand no. Mama next year ye be yamam. At least Who can't top up? Finance kakra na can't we. Now Baba Kato said there's no space in the budget. Who so a total bonuses. His Excellency John Dramani Mama. Adia health minister we wenye. One nurses for nkasa. Na say omudima no kwata kwa na obenyamo manyamo. Mamu nyana disaster and sigana na nkofun ansa ho. Mamu nyana nkofun wansa na mabeka na mabeye say nurses leaders ni forget about the politics. Lives are at stake. Ti mun to me meet demands ni kwa. Mun to me meet a little. Fanny said treating nurse for demand and say a national disaster NAC. Mobile allocate emergency funds for it. Now more allocate the funds to the nurses. No more come back to you. Now life in full lose on life. I want to apologize for assembly kind of disrespect to nurses. Ghana nurse, my sorry why said that me can't say yampamu. Mama meeting with demands. You can't say retired nurses and midwife. Mamu minister na some kind. Mamu ba na say mo betray mo colleague nurses and midwives from you here. And I heard of the nurses and midwives. Most of them will da. Some go tie. Omo doctors should. Omo hospital omo mo nurses man. Kakra no kan no.
Shouldn't we have an orientation for ministers? Shouldn't we have an orientation? Because a minister for health cannot talk like that. A minister for health says that, oh, government doesn't have money. I'm going to bring retired. I mean, he should be bowing down his head in shame. Total and absolute shame. The president, the vice president, the chief of staff should be reprimanding him tonight. And that's not the first. Look at what he did at Tamale Airport. Go there shouting on doctors, just shouting on them, do that, do that. You think because of politics you can shout on people? What does Minta Akando think politics mean? He doesn't understand that politics is service to people. Minta Akando, he doesn't get it. That politics is service to people. That politics is that he has become a boss. Or a boss over who? If we are all going to work at a private company, would they select him as a boss over anybody? That's what he should be asking himself. That's why they call it a privilege. It's a privilege to serve because you, Minta Akando, if we are all going to Unilever, they will not select you ahead of anybody. They will not. But you are a politician. We respect you for that. You have gone into the woods and told people to vote in a certain way, and they have listened to you, so we respect you for that. So when you become a minister of health, you have to understand that you are minister of health as a privilege. You are not clever more than anybody. And you are not. You, Minta Akando, you are not. Don't bring yourself. Because you are a health minister, you are not clever more than anybody. Minta Akando, you are not clever more than anyone anywhere. Because you are a politician. So we respect politicians because they lead the country. But don't abuse that respect and talk anyhow to people. Some of those nurses are better educated than you. Some of those nurses have paid more taxes than you can ever pay. You, Minta Akando, how much taxes have you paid in your life to the Ghanaian GRA? How much taxes have you paid? Some of those nurses that you are talking anyhow about, you, Minta Akando, they have paid more taxes than you will ever pay. You stand up, you become minister, and you think that that's the end of the world? Minta Akando, you think that's the end of the world? Because of what the world has become? Because politics has become so bad? No, take your time, calm down, and know that some of those people are very, very useful to Ghana. Even the amount of taxes they've paid. Some of them have educated 4 children. All the children are doctors. Some of them are single mothers. They've educated 4 children to go to Kolebu Medical School. They have 4 doctors. And you, Minta Akando, you go to Kolebu and shout on specialists because you are the minister. My goodness, that's so bad. Very, very bad. And I hope that President Mahama, this doesn't represent President Mahama's style. We all know President Mahama. This doesn't represent his style. Minta Akando, be very careful. Don't embarrass the president. He has given you an opportunity to serve. That's really what it is called, opportunity to serve. When the president was commissioning them, I was looking for the video. It took us too long, so I left it. Maybe I'll put it on social media. When the president was commissioning his first batch of ministers, including Minta Akando, if you remember, viewers, he said, watch how you talk because now you are ministers. That's what the president said. He was trying to draw a line between the campaign season and the working season. When we come to talk about Mr. Ansansadeli, I'll tell you something about campaign, difference between campaign and difference between managing the government. President Mahama said, you guys at some commission, Blackwa was there, you, Minta Akando, you were there, some George was there, Omani Boama was there. President Mahama told you, now that you have become ministers, learn and watch how you talk. Minta Akando didn't learn anything. He learned nothing. In any other country, tonight he would have tendered his resignation. Any other country, tonight he would have tendered his resignation. Maybe President Mahama will have mercy on him, but I hope they reprimand him. And when I hear him talk again tomorrow, I'm expecting to see a change in demeanor. His very, very demeanor and how he communicates must be worked upon. Don't they have people who train ministers for orientation? And if they don't have anybody, I'm here. They should hire me. I charge X millions for 30 minutes. I will tell them how to talk to Ghanaian people based on the constitutional provisions that sovereignty relies in the people of Ghana. Do they even read the constitution at all? These are people. Do they read it? The constitution, the fundamental thing said there first, that sovereignty. Sovereignty is the highest authority. That's what sovereignty means. Sovereignty means the highest authority in the land. It says sovereignty relies in the people of Ghana. It is for them. It is held on behalf of them by the government that is elected by them. Then you get elected, you become Minister of Health, and then you are talking anyhow to anyone. Minta Akando. Now, I'm going to play you Minta Akando again. This is Minta Akando speaking in opposition, speaking for nurses, speaking for health workers, as he was ranking member for the Committee on Health. Today, the ranking member for Committee of Health wanted to make a statement. The first deputy speaker said, you cannot make that statement. I've never heard some before. I've never heard a situation where there's a nurses strike, the ranking member of parliament wants to make a statement, and the speaker says you cannot make that statement. I'll be showing you that video. That's what they reported to us, that the speaker says he can't talk. I'm not sure what conversations they had before then, but this is what they reported to us.
I quench that thirst.
Burberry Hero, the new perform intense.
And the responsibility of this government has become legendary. And so I think that when it comes to matters of health, the government must move with alacrity because it borders on the lives of the people. I am not going into the merits and the demerits of why they are going on strike at the moment. But any reasonable government will engage them and then plead with them whilst they are even at the negotiation table to go back to their hospitals or their facilities. And so as a matter of urgency, I believe that government must respond to their call and make sure that these health workers are back to the hospital, because already we have a lot of challenges at the health facilities. They are leaving, in fact, they are fleeing from this country because of the economic conditions we find ourselves in. Now, when they take their salaries, they cannot buy anything with it. And so in a matter of between 2021 to 2023, we have lost not less than 69,000 health workers in this country. And so today, if you go to the facilities, if you go to the hospitals, you wait for hours because there's hopelessness in the system, because there's so much hardship in the system. And that is what government must be responding to. And so for me, the Constitution guarantees every citizen the right to health care. And so they must respond to the needs of the lab people.
That was Minta Akando speaking in opposition. Why, do they take us for granted? Why? What's the problem? They think that we don't know what we're about? So you speak in opposition like this so that you win power, and then you win power and you tell the nurses that we don't have money for you. That your thing you're asking for. It will cost us 2 billion. We don't have money. We don't have money. You don't have money for what? Nurses. But are nurses not a more integral part of the society than minister? Nurses. If there's no minister, the president can do the minister's work. A deputy minister can do the minister's work. Another person can do the minister's work. Nurses. You have to go through training. You don't need training to be minister. Nobody needs a training to be minister. There's no school that train ministers. So ministers can be done away with. In fact, in any case, under the Constitution, the only minister that the president is obliged to name is under Article 88. You can check. It's only in Article 88 that a minister has to be definitely named by the president. That is to say, it's only under Article 88 that the president cannot assume that responsibility of that minister, because the Constitution identifies. The Constitution doesn't identify a minister for finance. The Constitution doesn't identify a minister for trade. It does not identify a minister for... That is why one president can have 100 ministers and John Mahama can have 60 ministers. If I become president, I have 20 ministers, because it's just the way I name them is the way it doesn't matter. So ministers are not... They can be shifted. But the nurses, they are giving injection to children. They are doing polio immunization in the communities. They are the chip compounds. They are helping Ghanaians to live. When you see traffic, people going to work every day in traffic, say thank you to the nurses. Now, if the nurses are not there, go and look at the traffic situation. It will reduce because people are sick. They go to Kolebu, they have to go to lab, they have to pass here. Everything is health workers. You, Minister of Health, if you are not in Ghana for 2 months, we will not even know. When you travel and you are spending taxpayers' money and buying business class tickets that some ministers couldn't buy in private life, they become minister, they can buy business class tickets because the taxpayer is buying it for them. That's when they can buy business class, when the taxpayer is paying for it. And then you will not humble yourself and notice that you are in a privileged position to serve. You don't even notice it, that you are in a privileged position to serve. What happened to Ghana? Our former ministers were not like that. Do you remember Mrs. Brookman Emisa? For those of you who are my age, do you remember Brookman Emisa? Do you remember Major Courage Koshigan? These were health ministers who know how to talk and know how to respect people, not Minta Akando. He must be ashamed of himself. A health minister talks like this, that I'll go and bring back. Oh my goodness. He should go and read the platforms, on the preset platform. He should go and read it. What people were saying about him. He should go and read that this other one was brutal. He should go and read it and see how Ghanaians are angry with him. When we give you a privileged position, this is what you come and do. And this is Minta Akando speaking in opposition. Oh, the nurse's salary is small. Since 2021, they have not been paid. Then you become minister, and this is what you do. Lalai Baba. Okay, today I'm starting with the nurses one before I come to all the other gossip stories, which are also very important. Play me back the promo now, and after that I'll be on the table talking to two nurses who are here to tell us their story. We're going to ask them questions about why they are not going to work when